cut your finger and wonder how it stops bleeding? Well, this is a mechanism known as haemostasis. It is a physiological response to a blood vessel injury which stops bleeding. Haemostasis consists of three processes which occur in a rapid sequence: vasoconstriction, formulation of a platelet plug, and the coagulation cascade. Vasoconstriction is a result of the smooth muscle wall of the vessel contracting. During haemostasis, it occurs briefly to reduce blood flow to the injury while the clot forms. Primary haemostasis is also described as platelet plug formation. This relates to the platelets adhering together at the site of injury to form a plug. This is the initial blood clot formation. There are three steps to platelet plug formation: platelet adherence, activation, and aggregation. Intact blood vessels moderate the clotting nature of blood. The endothelial cells of intact blood vessels prevent coagulation by secreting platelet aggregation inhibitors. When an injury occurs, like a cut to the finger, subendothelial collagen is exposed on the epithelium. The endothelial cells stop secreting aggregation inhibitors. Instead, it secretes von Willebrand factor, or VWF. This causes platelet adherence in the initial clot formation. VWF causes the receptors on the platelets to adhere to the exposed subendothelial collagen and become partially activated. During platelet activation, the platelet releases important chemical mediators. Thromboxane A2 and adenosine diphosphate attract more platelets to the damaged area. VWF also releases an antihemophilic factor, which is a blood clotting protein. Primary hemostasis finalizes with the aggregation of the platelets into a plug-like formation. This covers the damaged component of the epithelium, reducing bleeding significantly. In minor injuries, the platelet plug will successfully stop the bleeding. However, if the wound is extensive, blood will not coagulate until the fibrin mesh from the coagulation cascade is produced. The third stage of hemostasis is the coagulation cascade. This is the formulation of a blood clot. It occurs simultaneously with primary hemostasis. There are two pathways for coagulation: extrinsic and intrinsic. The extrinsic activation is initiated by exposed tissue factor molecules on the vessel wall. Tissue factor forms a complex with factor VII, which leads to the activation of factor Xa. The intrinsic pathway begins with the damaged vessel. The subendothelial collagen activates factor XII, which produces a chain of factor activations resulting in a complex with an additional cofactor. This is factor Xa. Further down the cascade, factor Xa and factor Va combine, activating the production of thrombin. This small production of thrombin fully activates platelets and initiates a cascade of clotting factors. As a result, factor Xa-mediated generation leads to a large burst of thrombin production on the surface of platelets. Thrombin catalyzes the conversion of the soluble plasma protein fibrogen into insoluble fibrin strands. Simultaneously, thrombin also activates factor VII, which cross-links the fibrin strands. This forms an interlocking network of fibers and a framework for the clot known as the fibrin mesh. The fibrin mesh stabilizes the clot and traps more platelets and red blood cells, facilitating its growth. The clot begins to tighten as platelets shrink. This draws the vessel walls together, initiating the process of wound healing. Hemostasis is an essential physiological mechanism which allows for rapid blood clot formation and to avoid hemorrhage and conserve blood. It is crucial for health professionals to understand the process of hemostasis and the factors involved. This allows them to establish connections to diseases regarding issues with clotting, either excessive clotting diseases such as hypercoagulable disease, or the inability to form clots such as hemophilia.